Hi, today we're talking about discs, protrusions, and their connection to the hip joints. These ones, they are the biggest joints in our body. But before we talk about it and before we practice, I want to show you the difference between all of the joints that we have in our body. And we have just three kinds of joints. That's it, just three. One of them, the first one, it's the joint like seam joint. You see here at Peter's head. He's my assistant, his name is Peter. So see, seam joints, they're like, these bones are sewn together and they're done for the protection. Here we have a brain inside. I do, he doesn't. It has to be protected, so most of the time these joints do not move. Next joint is kind of half movemental joint. It's our spine, so these are vertebrae or facets, these bones, and between them we have intervertebral discs. And they are like shock absorber. I will tell you a bit more about them. And then we have joints that move really, really well. And they have a ball and then a bone that fits into this ball and move freely. If this part, normal people have two, Peter has one. If this part doesn't move freely, then the whole spine column is jeopardized. So this is how important our hip movement. But if it is kind of stuck together, calcinized, we can't really move it well enough. So let's find out how to grind this calcium inside of it and make our hips movable again. So the hip joints, so here, and we're gonna move in here. And I also promised to talk about intervertebral discs. So see, they're right between the bones, right between the facets. I'm gonna grab a ball to show you on a ball. So this is our disc. These are our facets. So when there is a pressure on the disc, it kind of squeezes. And if the pressure is too much, like for example, you sit and sit and sit at your desk, at your computer for a long time, so the discs are always squished. Finally, it ruptures and the jelly-like structure moves out. So what happens then? Between our vertebrae, we have nerves branching out of here. And this ruptured part and jelly-like structure of our discs, they start pressing on the nerve, and it really hurts. So in order for us to free up our nerves, what do we have to do? We have to move these vertebrae away from each other, and we have to build muscles around. Why do we need muscles around in here? Because as soon as you press on the discs, the humidity comes out. Let's say water comes out of it. But, so here, we pressed, right? Humidity comes out. But as soon as we release the pressure, it has to get the humidity, the water, from the nearest muscles. And if there is no muscles, the discs cannot restore. So this is why we need muscles. So let's restore the mobility of the hips, and then we'll build the muscles. Ready? Let's do it. We'll start working with our hip joints because we need their range of motion to work with the base of our spine. Good, so grab either block or some thick, good-sized book, step one foot on it, and start swinging your leg. This one has to be done with completely relaxed muscles of your leg, of your swinging leg. If you tighten up the muscles and if you try to kick it up really high, your muscles will not let your joint move freely. And why do we need this free motion? Remember I said that this joint, it's like a ball and the bone inside of the joint. So what we also have around this joint, we have a sac with synovial liquid. And this liquid works only at the time when the bones are moving inside of each other without any pressure. So right now, you're not working on the muscles, you're working on lubricating this joint. Also what you have to watch for, don't do it from your low back, do it from the hip. A bit of swinging. This leg could be slightly bent, could be totally straightened, it doesn't really matter. So do like 20-25 times with each leg. Okay? Good. So when you turn around, and you're gonna do it with the second leg. Again, remember, no kicking, no pushing back, just very relaxed motion. And this is why you're standing on something. Because if you try to do it with the relaxed foot on the floor, you won't be able to. See? You're gonna be sliding and hitting the floor. Thus, do it on the block. Okay? Good. Keep moving. And look, if you're doing it too much, you create exaggerated back bend in your low back. You don't want it. So this way, just swing. Nice. Good job. What else do you do for this hip joint? You just stand foot to the base of your foot and from side to side. Also here, many people, they twist. No. Keep your hips forward. And you open. Swing. Really swing. And the restoration of the joints requires many repetitions. Big number of repetitions, no weights. Changing the leg. Good. So now you are standing like this. Find these muscles, find them. And now bend your knees a little bit, one by one. But all of the work, make all of the work happening in your hip joints. So now remember this. Good. And you can do it without any pressure by lying down or by sitting somewhere on the chair. So you lift up and down, lift up and down. I'll show you from the side. So you can do it on your chair. Okay? So good. So now what do we do? You send one foot over to the other one and you lift the knee. Not out, in. So before you were opening out, now you're sending your hip in. So it's internal rotation of your knee. Okay? Like this. Good. Standing away, across. Grab the knee, lift it up, and now we're working with the spine. Round your back. So now we're stretching. We're opening the area of your lower back. Good. See? Head is down, but be very careful. If you feel that you're gonna fall, hold on to the wall or to the chair in front of you, okay? So, and change the side. Foot across, knee up, and round your back. Good. And exchange it a few times. Nice. So foot across, lift your knee up, round, tail is under. Good. Foot across, knee up, grab your knee, round your back, tail is under. Shake your feet right after. Next one. Remember where your hips are? And you're moving in a circle motion. Yep. Remember, lubricating. Good job. Nice. And change the direction. Good. And we're going down to all four. So we do need stretching. How do we stretch it? Drop tops of your feet down. Bump to your heels. Send your ribs forward to your knees. And from here go down. So here you have variations. Many people have bellies in front. So what do? We open the knees. And then you go forward. And you go down. Other variation, maybe not the belly, but maybe the issue with the knee. Not too many people can bend knee to this position and they cannot lower their bum down. What do? You grab a block and you put it here on your heels so you sit on the block. Or the blanket or the pillow, whatever you've got. Also, maybe this one, and maybe you can't really fall forward. So what do? Second pillow or cushion in front of you, and you fall forward. And if you've got sciatica, pinching of the nerve in here, this is your first aid pose. So you go down and you lie down like this. You can also rock from side to side. And you'll feel better. So slowly you're gonna go down lower and lower. Lower and lower. Just make sure you're not pressing into your head. Okay? Good. Lifting up. Second good pose for your low back. You're going down to your back. You lift your knees up and forehead to your knees. Again, if there is a belly, open your knees and stay here. If it works for you, grab your feet, forehead to your knees. So see? And this is good enough already for your low back. So let's continue to work with your hips. So we did swing motion forward and back. Now there is another swing motion. It's across. I'm gonna hold on here, but you have a chair in front of you and we're doing swings across. Yeah. Again, 20-25 times. Good. Again, no kicking, no kicking. Just gentle lubricating of your joint. That's it. And the second leg. And actually, by doing these kinds of swings and the other kind of swing, forward and back, you can diagnose yourself. You can see which joint moves freely, which leg forward and back. Many people have issue with moving the leg back from this joint. Probably the bum is too weak. Probably here the piriformis or quadriceps, they're too tight. So you need to find it out by yourself. And what I recommend, just when you do it, listen to your joints. Listen to what's happening. Listen to which one goes freely, which one feels kind of rusty. And work on it. Work on it without pressure. So we did the swings. What are we doing now? Ooh, these are one of my favorites. They're everywhere. Yoga, ballet, martial arts. In yoga, we call them goddess squats. So we're gonna send your feet really wide apart and gentle squatting. Gentle squatting. First 10, you do very lightly. And after you've done with the hip opening, you have to do something with hips rotating inward. So what do? You do hip in, but make sure it happens from the hip. So rotate it in. 1, 2, 3, 4, 5, and let's do second one. But in reality, you do like 20, 25 repetitions, okay? So you turn in. Again, it's from the hip, not from the knee, not the knee rotation, hip rotation, internal rotation. Good. Nice. And again, so this time you're going a bit lower. And you know what? If you have knees problem, do really tiny bit of squatting. Don't do the big squats. Do very, very gentle ones. For the knees, it's more probably like bouncing, not really squatting, if you have knees issues. And it's totally different story, but also connected to lubricating of your joints. Okay, so you've done these ones, and again, now stand still here and start rotating hip. But for this, you also require strength of your legs. Okay, here, rotate inward. And it's not really lunges where you do strength. Make sure there is no weight on the back leg. So see, it moves freely. Very freely. Same thing with the other one. Free movement. Okay? So in, hip goes in. Yeah. So this we've done dynamics. But also what you need to do, you have to do long holds. Long doesn't mean long forever. Long means 2 minutes. Why 2 minutes? Because the stretching is not really happening on your body muscles level. It happens here in your nervous system. So for example, you go down and you want to stretch, right? So you open up and you already feel, So what you do, it's your nervous system, it's your legs, you're crying now, oh my God, I'm gonna get ripped apart. No, what you have to do, you have to work with your nervous system. So you back out of this pose a little bit, so bring the legs closer towards each other. Yeah, feel comfortable in your pose. And for many people, this is already too much. So what you need to do, grab something to support yourself and to be comfortable, because most people will go back right away. So try to find where you're comfortable. Maybe even here, maybe here, totally up to you. Make sure, because look, what's happening if you go too far? You're not really working on stretching your legs anymore. You're working on overstretching your upper back. So belly forward, chest forward, and stay here. So here you're comfortable, stay here. Now, you need to make your nervous system get used to this position. For this, you time yourself for 2 minutes. And Remember, it has to be comfortable. Why comfortable? In a minute and a half, your nervous system will decide, oh, I'm comfortable. And it gives in. This is when you can open up your legs a bit more and use your 30 seconds. Important point. You cannot jump out of the stretch right away. So what you have to do, slowly grab the legs and move them back in. Okay? Slowly, very slowly. And don't go with the legs after the stretching, don't change your position drastically. So you brought the legs together, go back slowly down, slowly start bending the knees, straightening them again. So get the blood going, get the blood going. Yeah, a little bit. A little bit. And this set is more than enough to start working with your low back. And I'd like in the next one to show you a little bit more how do we work on working with the hip joints but on the bones level. Stay tuned.